All right. Hey, everybody. Welcome to Integrative Rehab Medicine's first Facebook Live. Now, we are not streaming on YouTube right now, but we will be in the future. We want to welcome you and say hello. I have with me, of course, Dr. Sebastian from Integrative Rehab Medicine. Dr. Sebastian, how are you doing today? It's what is it? It's Tuesday,
Thanks,
August 20th right now. How are
thanks,
things?
Corey. Yes, it's Tuesday afternoon, and we're doing very well. I'm Dr. Sebastian. I'm a physiatrist or rehab specialist, but also I'm a regenerative medicine specialist, and that's what I practice in our integrative medicine clinic. We do a lot of regenerative medicine and rehabilitation and help people heal. So let's talk about that.
I love it. Yeah. So today, folks, we're going to be just kind of like addressing some questions you might have. We have a couple that have been submitted already, so we're going to get right to those. There might be some overlap with some of the questions that you have, but we want to let you know that you can reach out at any time. We're going to have a special link for you where if you'd like to book an appointment and learn a little bit longer or a little bit more information in a longer discussion with Amanda, who's our team member that would be happy to take your call and maybe set you up for a consultation with Dr. Sebastian. We will get you all set up for that. But in addition, I want to make sure that I leave our phone number for you, and you're going to see it in the comments right there. And also our producer, Michael, who's behind the scenes, he will go ahead and put that on a banner at the bottom of the screen so you'll see it while we're talking. But that phone number that you're going to call to just set up time or more information is 239-653-8804. And we'll be happy to, learn a little bit more about your specific situation. So, Dr. Sebastian, I want to get right into it. Could you give us, I know that you have all these wonderful credentials and things like that, but could you help us understand a little bit more about your medical training, where you studied, how you did it, and how you came to owning your own practice over at IRM?
That's a long journey, a long path, but I am an osteopathic physician. So my medical school was in osteopathic medicine, and in osteopathy, kind of like MDs, we are DOs. We go through medical school, but our training has a little bit more approaches where we look at the whole body, we look at the spine, we look at the joints, and we put our hands on and we test them and we manipulate. So it's a very hands-on type of approach, and a lot more open to a holistic approach where we're looking at the whole body, mind, and spirit. And that allows us to have this open look and view of the human being. So then I did my internship and residency training in physical medicine and rehabilitation. So I've learned a lot about people's injuries and how to get them better and rehabilitate them. One of my goals in life as a medical professional was to help patients treat injuries or help patients heal from injuries without needing surgeries or without needing medication. How can I naturally heal? So as a physiatrist or physical medicine and rehab specialist, and that's my board certification, that's what I did for 4 years in training. We learned how to help patients rehabilitate. And then I got into regenerative medicine. That's the biggest thing in my life that I've been always so excited about. And that was a journey over the last 20 years as well, learning how to help patients use their own body tissues like their stem cells or their or platelets or other products that we can use to help patients improve their healing journey. So we took all of that and created integrative rehab medicine, where I am using regenerative medicine, which is usually given through an injection of some sort. And then we're using rehabilitation. We're working with physical therapists in our clinic and in the community. And then we're working with our patients on their nutrition, their mental well-being, really looking at the whole person to help them heal from their injuries, be it a shoulder injury, a neck injury, knee, anything. The whole idea, again, is to stimulate the body to improve health and their tissues.
It's a great time to get into one of our first questions as we hear about some of that background. And that word that you mentioned was that, integrative, regenerative medicine. What is regenerative medicine? Because I know that you mentioned injuries, right? And people recovering from injuries. But as people will soon find out, folks, I'm a patient of Dr. Sebastian's, believe it or not. He helped me with my back, and I did the PRP therapy with him. And I also happen to be hosting this Facebook Live. So for me, it's very personal, but mine wasn't an injury. It was kind of one of those things where, it was like a micro impact over time, that kind of wore away. So I guess, is it more genetics? Is it
So we can
an
talk about the
injury?
injuries and then the potential, the rehabilitation and the regenerative medicine treatment. So
Yeah.
injuries can happen in many different ways. They can be a cumulative, repetitive injury. So, let's say you have a worker or somebody who works and lifts all day long. So they're constantly stressing their spine. They're stretching their ligaments. They're potentially stressing their discs. And this accumulation of micro injuries can then lead to a degenerated spine. So it doesn't have to be an injured back or an injured shoulder. Same thing with the shoulder. Someone who does a lot of overhead lifting and may have some weakness or instability. This continuous injury, and again, being even a micro injury, leads to degeneration of those tendons, to those discs, degenerations of those muscles, and then the spine or the shoulder becomes unhealthy, becomes weak, becomes painful, becomes inflamed. So regenerative medicine, the place of regenerative medicine is to help that tissue that was either injured from the chronic use or from an acute injury. Let's say someone bends over and, oh no, I herniated disc, or someone
Yeah.
catches a ball and tears a rotator cuff. That's more of an acute injury. With regenerative medicine, we use an injection of platelets or stem cells injected specifically to that area, to the back, to the nerve. I see Sherry's over there. Hi, Sherry. We've treated her nerves as well, and she's been doing pretty good, amazing recovery. So, we can inject these platelets or stem cells into the tendons, into the discs, into the spine. And what that does, and what regenerative medicine does, it stimulates that healing response. It stimulates the immune system to go down to that area that we injected and start the healing process. It kickstarts the healing process. It hurts a little bit right after the procedure, but then the inflammation and all that immune cells, the stem cells, the macrophages go in there, and they start the healing process. And then the patients follow through with some specific exercises or with nutrition, typically all of that. So that's what regenerative medicine is finding that area that's been injured or chronically degenerated, putting some type of a cell, either stem cells or platelets, around the nerve, around the tendon, and stimulate that immune system to start healing these tissues. And that's regenerative medicine, and I think it's the forefront of medicine because instead of going out there and cutting things or suturing things with surgery, we use the body's own innate ability to heal to regenerate those tissues, and that's why I think regenerative medicine is amazing. I sleep and live and dream of regenerative medicine every day.
Yeah, I'll take it a step further, and it's like, I think when we injure ourselves, a lot of times what we do is we go to other medical professionals that will give you things that will mask or temporarily relieve the problem. But what we're doing with regenerative medicine, from what I understand, I'm not a doctor, I just play one on Facebook Live, is we need to treat the actual issue itself and then help direct the body to where to fix the problem. And that is where our PRP comes in. Now, we're going to get to PRP in a second, but we do have a question from Mike and Sherry.
Let me tell you one more thing, because you made a good point. We need to identify the injury, and very often it's not just that one low tissue. So we see people that come in with a rotator cuff tear or a degenerated disc. And so sometimes some people that may have not as much experience with the holistic regenerative medicine may say, okay, I'm going to put some PRP or stem cells just in that tendon or just in a disc. And it usually is much more. It's usually all the ligaments, all the muscles, all the tendons that support that tissue that need to be treated. So, in the real good regenerative medicine treatments, usually it's a multiple type of injections because we're treating all the structures. We're treating the tendons, we're treating the ligaments that support the shoulder, we're treating the muscles, we're releasing nerves. So all of that usually provides the best response and the best healing. And that needs to be diagnosed properly and identified and then treated as a holistic, whole joint, whole body.
Yeah. We have a question from Mike. Mike, thanks for your question. The question is, what's your biggest success story with a client using PRP? How many lumbar L4 and L5 procedures have you done? Wow, great question. Very specific too. Mike, feel free to send us more. We're here for you. So, Dr. Sebastian, do you have a answer to that?
Thanks for the questions. I've been doing for the last, I would say, 15 or maybe 16 years, not even longer. I've done a lot of spines, maybe 1,000, maybe over 1,000, probably even more. I haven't counted. I mean, every day. Today we did 2 spinal treatments. We actually did. I had a patient today that, let's see, he flew in from where was he? From Virginia, and we treated his L3, L4, L5 disc. We put some PRP into that disc. We also treated all the ligaments, and then we gave him an epidural. I had 2 treatments there. So every day I do treat people's spine, either the neck or the back. So tons of it, I'd say more than 1,000 procedures. Success stories are great. I mean, what's my greatest? I would say about 80% of patients are a success story. So we really find that most people seem to improve. And it's not perfect, not everybody. There's some people that just, sometimes this is not enough. Their spine is too degenerated. Their discs are far too herniated and more than we can help. And they may need either surgery or something else, or sometimes even surgery is not for them. They need pain management. But about 80% of our patients get significant improvement with usually multiple treatments, because one treatment gets the body going, gets it started to heal, and then the patient has to support it with the rehabilitation and diet. And then usually a second treatment and sometimes a third treatment, and the spine gets stronger and stronger. And if the discs are injured, then we can use either ozone to shrink a herniated disc, or we can use PRP or stem cells or even fibrin glue to seal a disc and make it healthier. But then we treat all the other ligaments, tendons, and muscles. And usually, I have a lot of success stories. You can see some on my YouTube channel. But it takes time. So it's not like I give you a shot and you feel better in a week or 2. Over the months, as you get stronger and your spine gets healthier, that area improves, and then you support it with the physical therapy, and then you become your own success story. So everybody has different goals. I have some patients who, they just want to be able to walk a little bit better and want to be able to play with their grandkids. So we find, okay, what are your goals, your functional goals? I want to run a marathon. Okay, so we plan ahead. We play, okay, how many months do we have? We have 6 months. Okay, these are the treatments we're going to need to do, and we get them closer and closer to their functional goals. So about 80% of our patients reach their functional goals, and that's not always 100% pain-free, but it's to the goal that they want to be able to function at. So thanks, Mike. Good question. Hope that helps.
Thank you, Mike. And Josh, we see your question. We're going to come to you next.
Hey, Josh.
I do want to let everyone know that in the comments on this post, you're going to find a link to a URL that's going to give you not only a little bit more of a description. It's not going to be clickable, obviously, on the screen, but inside of the comments, you can go over there and just click on that. That'll take you to our page with testimonials, a little bit more about PRP, a video from Dr. Sebastian, everything else for you. So we'll have you all set. Josh's question is, it seems like about a hydrodissection. Why would it be helpful in relieving his neurological symptoms? I don't know if we have enough info to answer that, but we might be able to.
So so nerves can get swollen and irritated and inflamed, and that can cause pain down the arm, down the shoulder, can cause pain into the neck. And I'm talking about the neck because that's what we were talking about with Josh. So those nerves, when they're inflamed, they can cause pain, they can cause numbness, weakness. They can also cause some other neurologic symptoms like dizziness, brain fog. So those nerves can get injured from, let's say, a pinched nerve by a disc, or from some arthritis, or some people that have hypermobility or instability. Those nerves can get congested or sometimes stuck in between tissues. They can get kind of caught between tissues. So if this is a nerve and the tissue is squeezing it, that can cause the nerve to get inflamed. So when we do a hydrodissection, I use an ultrasound, I find that nerve and I find the tissue that seems to be constricting it, and we release it. That's the hydrodissection. Hydro means fluid. That's what we use dextrose 5%, and that fluid pressure opens up any of that nerve constriction, and that's the dissection component. So the hydrodissection releases that nerve, but also the fluid itself that we use, either dextrose or sometimes platelet release state or platelet-rich plasma, that also feeds the nerve and makes the nerve less irritable. So that nerve now no longer is constantly irritated and firing like crazy. That nerve starts to fire a little bit more normally and calms down, becomes less irritated, and starts functioning. So sometimes a couple of those treatments release that nerve the dextrose or the platelet-rich plasma heal the nerve, and therefore the neurologic symptoms get better and better. And I know Sherry's got something to say about that too. So there's quite a few patients that we treat the arms, the neck, the back, legs, foot drop. We have really good results with people who have foot weakness. So I hope that answers your question.
Yeah, this is wonderful. It's one of those things, as you were talking, you said ultrasound. I use an ultrasound to find where exactly to go. And I think when people hear about needles or they hear about injections or things of that nature, there's a lot of shady stuff out there, folks. When I was searching for PRP myself, there was a doctor doing it out of their garage or out of a strip mall plaza, and you're just like, what is going on? Dr. Sebastian, can you tell me about your offices? And just so everyone knows, they're located in Estero, Florida, but you don't have to be local to come to the office. I drove 3.5 hours in 9 out of 10 pain to get to Dr. Sebastian. And we have people.
What's your flight?
Yeah.
Harry flies in here.
Yes, yeah. It's you threw me off there.
Sorry. So we are located in Estero, but we have patients. You're right. You don't have to be in Estero or Southwest Florida. We have patients coming from all over the country. We have, people driving from Orlando, from Miami. We have people flying in from New Jersey, New York. I have people coming from out of country, Poland, Canada. So, because they know that people get a good treatment here, and I try my best. I think I do a pretty good job. And to answer one of your questions with the ultrasound and the X-ray and some other places that don't use that. So yes, there's a lot of shady places doing shady things. I've had extensive training in how to use an X-ray to put a needle into somebody's disc, into their necks, into their back, or how to use an ultrasound to find a nerve and release it. So everything that we do is always ultrasound or X-ray guided to really identify the structures and really get the most precise procedure, but also make it safe. Because if you just stick a needle anywhere without, I think it needs to go there, you can hurt people. And how do I know? Because I've seen people who got hurt. So we've treated them afterwards. So using an ultrasound helps me, and an X-ray helps me guide my procedure in the right place.
Mike has one more question, and then Josh would like us to explain the difference between prolotherapy, PRP, and stem cells. That's a great question.
Yeah, so regenerative medicine, again, is using some type of injection of an agent that will stimulate the healing process. And it started really with prolotherapy. That was the starting point of regenerative medicine with Dr. Hackett and Hamwall. This was in the 1930s, where he found out that if he uses dextrose, that's prolotherapy, and he injects it into ligaments, it stimulates the ligaments to get stronger and healthier. It helps to heal the damage, and it tightens them up. So people that have loose ligaments or injuries to those ligaments that got stretched, the dextrose, which is the prolotherapy, can cause those ligaments to swell up and tighten up and heal. So prolotherapy is the kind of the most basic, yet I use it a lot. And I think everybody who does regenerative medicine should learn and start with prolotherapy, which, I took years and years of training. I went to Honduras for a couple of weeks to train on prolotherapy. I've taken courses and learned how to do it, the prolotherapy treatments. Again, we're injecting dextrose in all the ligaments, tendons, and muscles to stimulate the healing. Then PRP is where we use your blood, and we take the blood and we concentrate the platelets. So PRP stands for platelet-rich plasma. And the platelets have all these wonderful growth factors. So when we inject PRP into an injury, those platelets release their growth factors, and that stimulates the stem cells and other cells to come to that area and do the healing process. And then you have stem cells. Stem cells is the kind of the latest, it's the most advanced as far as those biologics. Well, the more advanced, I would say. And that's where we actually take cells, usually take them from the pelvis, because that's the highest concentration of the stem cells. We take those cells, we concentrate those cells, and we inject them to the area. And those stem cells, they're not going to turn into cartilage or muscle or anything. They're like master sensors. They sense the environment, and they're like, okay, I need to spray a little bit of growth factor here, spray a little bit of growth factor there. So they're sensing and constantly releasing the growth factors. And they can stay there for maybe, days to weeks, sometimes even longer. if they're given in the right environment. So again, prolotherapy is the dextrose, PRP is the platelets, which only stay there for about a day or two and release all the growth factors. And then the stem cells is where we put those cells and they're sitting there for a little bit longer, sensing the environment and constantly releasing whatever growth factors are necessary based on their sensations. Hope that helps, John.
I muted myself because I'm in Florida. I'm a little bit north of you, and it just started downpouring, so it was so loud. So I muted myself for a second. Yeah, I think that's a wonderful way to explain it, and it makes a ton of sense. So thanks for that. One of the things that I wanted to call attention to was the fact that Dr. Unica, your wife, is at the practice. And some of the work that she does actually complements some of the work you do. So, we're talking about these different regenerative medicine pieces, but I think there's a special piece to what Dr. Unica does that really I want to mention for her, to let her know we love her, and then also to make sure that the people that are listening understand that it's not just about the actual procedure itself. It's really taking care of the whole patient, maybe before, but a lot after, so that they can not only have the effects of the procedure help, but really compound on top of that and learn to make some changes to hopefully prevent future, appointments. You know what I mean?
It's a whole healing journey, and it takes a team. So, I go out and meet with a lot of doctors and physical therapists in the area. I have a whole network of people that I work with. And I always stress that none of us are going to treat our patients in silo. It's a whole team approach, including here in my clinic. So Dr. Unica, she does acupuncture. She also does some facial rejuvenation. It's nice, when people are feeling better, they want to look beautiful too. So she does PRP for the face and the hair. But the acupuncture is what she does very often with a lot of our patients. And the acupuncture works more of an energetic model, where in Oriental medicine, in Oriental medicine doesn't look at the tendons, ligaments, and muscles. It looks at more at the flow of energy, which is called qi. Interestingly, a lot of these qi acupuncture points correspond to specific nerve exit points that we use for our nerve treatments too. So, when you stick the little tiny needles and sometimes connect electrical impulses to them, it stimulates the flow of that electrical current or the qi, and that improves the healing response. So we use that. It is an integrative medicine clinic. We are using acupuncture. We're making sure that our patients are eating healthy. We use lasers too. So usually after a treatment, we use red light therapy and laser, which further stimulates the healing. We have our therapist that works with our patients here, or therapists that I collaborate with, all over the country, all over the states. And so that is a large team that usually helps with the healing journey. Hope that answers your question.
Yeah, I think so. We have another one coming in here. What is your opinion of PICL? I don't even know what that is. Are you familiar with that?
I am, yeah. So PICL is a procedure that Dr. Centeno does in Colorado for people with upper cervical instability. So upper cervical instability is when the ligaments of the neck are just too loose and things are moving too much, and that can cause all these neurologic symptoms. And the way I treat it from the back. We use an X-ray. We guide the needles into some of the ligaments that support the neck, and that can stimulate the ligaments to get tighter and stronger. PICL was invented by Dr. Centeno, and what he does, he goes through the front, through the mouth, and it gets some of the ligaments of the C1, C2 area, and he's able to stabilize it potentially in some people who are severely unstable. And what is my opinion? Just like anything else, it can be helpful, but it is not perfect. I've had patients who've had the PICL. Actually, I had a woman yesterday. We were doing her upper cervical with the X-ray guidance, and she's had the PICL twice or 2 or 3 times already, and she didn't get the instability improvement that she was looking for. Spent a lot of money, unfortunately, but it didn't provide the stability. But then there's other patients who do well too. I don't know the success rate. I'm sure there's some data out there, maybe third-party data, to see, how successful people symptoms improve. It is a procedure. It is more invasive. It's very expensive, and it can help. We'll see. We'll see what comes out over the next couple of years. We'll see some data come out, hopefully.
Okay, we're going to do one more question after this one. So guys, awesome. Thank you so much for being here. But we're going to do one more question after this. So Mike says, is stem regen something we should use? Has Dr. Sebastian treated the thoracic spine region, and does PRP reduce spine arthritis? Those are three separate questions. You got that?
I'll just go ahead and go into it. So stem
Yeah.
regen, I think, Mike, we may have talked about that. That is a oral product that is a supplement and multiple vitamins and herbal substances, and I think some roots too, that stimulate your body to produce more stem cells. That's the theory. I'm not sure yet about the data yet. I would have to spend some more time in researching it. Because if we can get our body to produce more stem cells, that potentially can help the results of what we're doing, or it can just help you in general to heal better. So I think that's something worth exploring. I'm not sure how expensive it is and what it is, but there's many things you can do to stimulate your stem cells naturally without going to a supplement like this. One of them is intermittent fasting. So I fast every Monday. I don't eat for 24 hours. And that helps my body, puts my body in this low micro stress, which then stimulates your body to produce more stem cells. Specific type of aerobic exercises, doing some strong interval training can stimulate your body to produce stem cells as well. So there's, again, other things we can do. The second part of the question was, do I treat thoracic spine? Yes, absolutely. We treat I treat the whole spine: cervical, thoracic, lumbar. It can help a lot of people that have injury in their muscles, in their tendons, and in their joints. If we do PRP into all of those structures, it can be very helpful at strengthening the spine, decreasing the pain. And the third part of your question, Mike, was about arthritis. And PRP is very effective for arthritis. Spinal arthritis, so the facet joints, the joints in the back of the spine, when they become inflamed and arthritic, we can put a little bit of PRP, very high concentration PRP. We have a lab in our clinic. Our lab allows us to really produce whatever kind of PRP we want. And I know a lot of places don't have that. We invested the money to create a lab because we can create a PRP that's 10, 12, 15 times even more concentrated than your blood. And that can be injected into these facet joints or arthritic joints. And that high concentrated PRP, and especially in amyloid people, can be very effective at decreasing the inflammation, making the joint healthier, a little bit more stable. And that's in the cervical, thoracic, lumbar spine. We do it all the time. I think that answers your three questions.
Yeah, that was great. He got three for one there. There we go. Okay, this is our last question. And it is, greetings from Alaska. A year ago, I suffered a contusion of my cervical spinal cord during surgery, which has left me with widespread damage, upper and lower extremities, torso, and hips. Is there any progress towards having regenerative medicine recognized by insurance companies as being successful and not experimental? In this area, they typically deny claims for these types of treatments. This is a great question because technically right now, well, I'll let you get into it.
Well, there's multiple parts to this question. Saiji, I don't know if I'm saying your name correctly, but thanks for tuning in from Alaska. I know you're a different time zone there. Unfortunately, when it comes to spinal cord injuries, regenerative medicine hasn't been as good there yet. We can treat the spinal ligaments, the spinal nerves, the discs, a lot of structures, but when it comes to the spinal cord, we're not very successful yet. Could there be more? Potentially. I know there's a doctor in the Dominican Republic where he works with some cardiologists, and they take stem cells and they inject it into the arteries that feed the spinal cord. And he claims that sometimes that improves some of the spinal cord function because those stem cells get exactly into the spinal cord without damaging the spinal cord. But again, that is experimental. When it comes to the regenerative medicine that we do here, not spinal cord related, I would not say this is experimental. There's tons of data coming out on regenerative medicine and its efficacy for joints, for the spine, for the rotator cuff. So if you go to my website and look at my blog, I usually do different reviews of some of the latest studies. We reviewed a study cells being used for rotator cuff tears. It used to be thought if you have a tear, you have to have surgery. Well, no, stem cells can actually heal that tear. So I reviewed two studies. One was bone marrow stem cells and the other one was adipose. For arthritis of the knee, for nerve injuries, neuropathies. There's a good study came out of Egypt showing that people with diabetic neuropathy have great results with pain, function. We have quite a few patients who we treat their neuropathy. So I don't think this is experimental. I think, again, there's issues with politics, and insurance doesn't cover it at this point. I think, again, a lot of it is political. But I'll be honest with you, if insurance got involved and they did cover it, they would screw it up. And in that, I mean, pain managements are one example where they got screwed up. You used to be able to go see a pain management doctor and get steroid injections in multiple facet joints. If you have, let's say, 4 or 5 joints in your spine that were arthritic and you want to get a steroid shot just to get some temporary relief, well, pain management doctors, as a doctor, could say, okay, I see, these are your problems, I'm going to inject all 5 joints. But insurance got involved and they say, no, you can only do 2 joints because anything more than 2 is medically not necessary. I mean, who makes that decision, right? Who makes that decision if medical is necessary? This is just one example of many. When we treat nerve injuries, I used to take insurance for treating nerve dissections, but then they said, oh, you can't do more than 3 because more than 3 is not medically necessary, or you can't do it if they don't have weakness, or it was weird. They make up rules that make no sense. So if insurance got involved and they said, okay, we're going to pay for this, but by the way, we're not going to pay you what you think you're worth. We're going to pay you what we think you're worth. And we're only going to tell you what you can do. And you can't do this, you can't do that, you can't do this, but you can maybe do that. When I do a knee treatment, I treat the joint inside, but then I treat all the ligaments, the tendons, the muscles. It's like 8, 9, 10 structures that are being treated. If insurance got involved, they said, no, you can do 1 at a time. So I'd have to bring the patient 10 times to treat everything separate. It's ridiculous.
Right.
So, unfortunately, they don't cover it, but at the same time, it is fortunate because it gives us the freedom to be doctors and treat the patients how we feel is necessary. And that's the world we live in at this point, and we'll see what happens in the future.
Well, I just want to say thank you to you for taking the time to come on and do these Ask Me Anythings. This is our first live. We're going to be doing a couple more. And as we do more, of course, we'll be broadcasting on YouTube as well with a simulcast. And then we will also be, changing the topic. So one, week we might be talking about the shoulder. One week we might be talking about knees and the spine and other things. But there's 2 things that I want anyone watching to do. At the bottom, you're going to see a phone number. Feel free to call. Just you'll find your way to Amanda, who is our amazing liaison to Dr. Sebastian that will get you to him so you can have a consultation. Now, this consultation actually could be covered by your insurance. So the consultation itself is a chance for Dr. Sebastian to look at your specific case, to understand exactly what's going on. If you do have an MRI or an X-ray, those are going to be very, very important. Just make sure that they're done within the last year. And then in addition to that, if you go to the comments section of this Facebook Live, you're going to see a link, and that link will have a URL in it that will take you to our landing page that has testimonials, a little bit more about what Dr. Sebastian does, video from him, and more. We really appreciate you guys tuning in and watching. Again, you're part of our first live, so we're so thankful. And Dr. Sebastian, why don't you take us out?
Well, again, Corey, thank you very much for hosting this. I appreciate it. I look forward to working with you more on this. I look forward to answering more questions and really exploring regenerative medicine. My goal in life is to make regenerative medicine available and make it the best thing possible and help as many people as possible. But I also want to educate. I educate. I teach lectures. I go to workshops. I'm teaching a workshop in Cancun in a couple of weeks. I'm going to do a 1-week workshop that I'm going to be teaching doctors from all over the world on how to do regenerative medicine. So my goal is to teach doctors and the public. So if you have any more questions, or if you have some ideas for a Facebook Live event, please email us or just suggest it, and I'll be more than happy to tailor one to you. So I look forward to more, and thank you very much for tuning in.
Thanks, everybody.